So, welcome Professor Jonathan Sackier. You're a faculty member here at the International Colorectal Disease Symposium. Can you tell us a little bit about how you got involved with the event?
Sure. Well, the event was managed by, it's actually a joint event between the Cleveland Clinic and the Israeli Colorectal Society. Steve Wexner, Professor Steve Wexner, runs colorectal surgery and many other things at the Cleveland Clinic based out in Florida. And Steve and I have known each other for many, many years and collaborated on a number of projects. We've written books together, research projects, and are friends. And I've been a huge admirer of this course and been in the past.
Yeah.
And this year I was very honoured to be asked to speak as a member of the faculty.
Fantastic. So Emg Health are we're producing the official publication of the conference, and we're sponsoring the awards ceremony. Tell us a little bit about how that can benefit yourself as a surgeon.
Well, when I first learned about EMG and what you do, it really got my attention because your model is, I think, unique. I don't know anyone else who does what you do, and certainly I don't know anyone who does EPS publications, conference reporting as well as you do. The quality of the work blew me away, quite frankly. Very, very easily digestible, well written, well produced, and the fact that you then circulate it to hundreds of thousands of doctors around the world is astonishing. You know, we participate in conferences either as faculty members or in the audience, and I'm in both. I do a lot of listening when I come to these events.
Yeah.
We do it because we want to improve patient care by improving our education, our knowledge base. And I don't know, there's a few hundred people at this event. It's very well attended for a specialty conference. But there's thousands of doctors around the world who could benefit from hearing what's gone on here, and you make that happen quite frankly. So thank you.
So that's very kind of you. So how else can companies such as EMG work with healthcare professionals to benefit them in similar sorts of projects to this, but also in any other ways?
Well, my answer, first of all, would be I'm not sure that there are companies like EMG. I mean, I've been around for a fair few years, and I've certainly never come across a company who does what you do. I think the fact that you have a multimedia approach to it is very, very intriguing because, doctors, we're busy. It's a busy profession.
Yeah.
We spend time in our cars driving to work. We spend time on the treadmill or going for a run, listening to podcasts. We spend time obviously reading journals and coming to events, and I understand you also put events on, do podcasts, I understand, and maybe many more activities that I've yet to learn about. It means that I've got the opportunity to access the information in many formats at different times of my day, and that's very appealing to me.
Yeah.
And the fact that you also, I understand you cover many therapeutic areas.
Yeah, we do about 18 different therapeutic areas.
It's important that I, as a surgeon, someone who's practiced for many years, that I know what's happening in other disease areas, because number one, to improve my general medical knowledge, but number two, there are things that transfer from one specialty to another.
Yeah. Now, as a company, we've been fairly successful in Europe so far. We work with all of the top 20 pharmaceutical companies. We have nearly 500,000 healthcare professionals. We're looking to launch into the US this year. We're launching 7 journals in the US this year. As someone that's worked on both sides of the pond, so to speak, what would you say are the biggest differences between the two?
Well, American English is a little bit different to English. So make sure that you get the spelling right for the Americans. It's aluminum, it's not aluminium.
Yeah.
I think there are more similarities than there are differences. Patients are patients, medicine is medicine.
Yeah.
The quality of medical care and the quality of education is remarkably similar around the world. I've had the privilege of traveling to many, many countries, operating and teaching in many countries. And I don't find, honestly, that many difficulties, differences. There are some separations about which specialty looks after which patients, so that might be interesting. But no, I mean, people have multi-specialty teams. People have conferences within the hospital, weekly conferences, monthly conferences. People attend meetings, people read journals, people talk to their colleagues. So I wish you great success with the enterprise. Obviously, there's many more pharmaceutical companies and I would say medical device companies. I don't know if Emg does business with the medtech sector. If you don't, I think you should, because the quality of what I've seen you produce, it's germane to the orthopedic companies and the general surgery companies and the colorectal companies. So I wish you great success with it.
And on that note, finally, you mentioned the pharma and the medtech, and as well as being a surgeon, you're also an innovator yourself. You've worked with and set up a number of companies. What would you say would be the number one benefit to a company of working with Emg?
Well, whether you're a small company just getting going or you're a large company, the key thing is getting them. Number one, you have to develop the technology, you have to get it reimbursed, you have to get it approved by regulators, and then you have to tell people about it.
Yeah.
And it's become harder and harder. People aren't going to as many conferences, and there aren't. In the old days, there used to be these industrial exhibits, and all the pharma companies, pharmaceutical companies, all the medtech companies would display their wares.
Yeah.
That's become harder. Reps used to come and call on us. That's become harder. Many hospitals don't allow reps to cross their threshold.
Yeah.
So I would think for the services you offer, as I best understand them, could be hugely helpful to pharmaceutical, medical device, biotechnology, medical service companies that do software, for instance. As physicians, surgeons, we are reliant upon the medical technology and pharmaceutical sector. It's a sector that gets badmouthed a lot, and that irritates me personally. Because the vast majority of people I've met from the industry are good, caring people whose interests are aligned with mine, finding ways to help sick people get better, because we're all going to be patients sooner or later.
I think it's key what you said there. In this day and age, you can't just put promotional content out there. You've got to educate the people to make them a better person and to do a better job. So
and quite frankly, physicians don't really want promotion. They want the facts. Right? This is an evidence-based profession. We have an awesome responsibility to do the right things for our patients. To do that, we need the facts. We need to know, does this medication work in this? Will it likely work in this patient? Or is this medication better? Is this the right tool to use for this surgical procedure? We want the facts, and quite frankly, educational content, which I understand you give doctors the opportunity to provide it free of charge, which is, I've never heard of that. I've never heard of that. And I understand how the content is supported, but this is a win-win situation. It's a win for the patients, it's a win for the doctors, and it's a win for the companies you work with.
There's no subscription fee, there's no charge to the doctors to write. We're funded by pharma. Doctors are clever enough to know what's funded by pharma. It has its full disclosure. It's the money is going around in the same way. It just means that it's a win-win for everyone. We can help the pharma companies extend their reach before, during, and after their congresses. The doctors get educated. As I say, it's a win-win.
Well, that's a key point you make, Spencer, because before, during, and after. So, number one, before will help get the right people to come to the Congress, and it can mean that the doctors who can't make it to the Congress will know to look out for information coming down the pipe. During, I presume you use your multimedia approach to best educate the people who are at the conference, and even I understand you put events on.
And we get takeaways from the events, lots of interviews like this that we're doing at there.
And then after, it means not only making sure that the people who came, there's the old aphorism, tell them what you're going to tell them, and then tell them what you told them. But the people who couldn't make it to the conference, you can now take that educational content that people put a lot of effort into, and you can make it available to people who couldn't be there. I think it's marvellous.
Well, thank you very much. Thank you for your time.
You're very welcome.
Pleasure to meet you, and
Likewise.
enjoy the rest of the conference.
Thank you, and best of success in America.